Welcome back to our Dental Spotlight. I'm Dr. Sharma from Provident Dentistry.
And I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park.
Today we're going to talk about habits that are not good for your teeth. So let's start. Number one, nail biting. That is really a bad habit that a lot of people have. It not only causes ugly looking nails, but it also can cause jaw problems and teeth problems, number one, of course. So if you're a chronic nail biter, just make sure that you try and break this habit. And you know, a lot of time people say, you know, the best way to break a habit is get your nails done. Yeah. So that way you'll stop biting your nails. Now, biting nails can cause teeth and jaw problems, as I mentioned. You can get chipped teeth or you can have jaw problems for chronic nail biters. Your jaw constantly is in the position of biting your nails and it causes dysfunction and pain of the jaw. But the number one thing too is that causing your teeth to chip and break may require fillings or crowns.
So number two is frequent snacking or drinking. Every time you take a bite or a sip of something with carbohydrates in it, even healthy things like fruit, this changes the acid balance in your mouth to favor the cavity-causing bacteria. And this acid balance change lasts for about a half hour. So if you're constantly snacking or sipping throughout the day, your mouth is constantly in a state that allows for that cavity-friendly bacteria. So try and remember the phrase sip all day and get decay, and this goes for sports drinks especially.
Number three, brushing really hard or using an extra hard toothbrush that can cause a lot of problems to your teeth. You think that you're doing a good job by scrubbing really hard and having an extra clean mouth, but no, you're wrong. You're actually damaging your teeth quite a bit. The hard brushes often develop gum recession, or sometimes what they do is cause notching of your teeth, and those are areas that can cause sensitivity and problems. Hard brushes can also cut into your enamel and then dentin, causing that notching, as I mentioned a bit earlier. A good remedy for reducing this problem is using an electric toothbrush or an extra soft brush. So an electric toothbrush, also make sure you don't apply too much pressure. A lot of them show a red light when you do that. So make sure you back off a bit, use a back and forth movement, a rotatory movement, back and forth, a wiggly movement, or just sticks to an extra soft toothbrush.
And number four, opening packages or items with your teeth. Sure, it's convenient, but just take the extra time to grab a pair of scissors. A lot of times that when you're trying to open packages, the pressure that you do from that can crack your tooth. Also, while we're on that topic, ice. We actually have a patient coming in today that broke their tooth from chewing on ice, so no chewing on ice.
Number five, bedtime bottles for babies. A similar reason that we say don't sip all day long, this is a big no-no for infants. Both breast milk and bottle milk contain sugar. And what happens if they sip it on at night just before bed, it sits in your mouth for quite some time, and that makes it easy for the teeth to start getting cavities and have problems for children. And these kind of situations have their own name. It's called as baby bottle syndrome or baby bottle decay. And quite often we see it on babies when they come and they have, you know, decay all around their front teeth. So that needs to be avoided.
Yes. Number six is sucking on candy. Some people with dry mouth, they suck on candy because it provides a temporary relief. It stimulates the saliva flow. The problem with that is that people with dry mouth are already more prone to cavities because saliva is protective, and when you're lacking that, you're more prone to cavities. So mixing the candy with the dry mouth is a recipe for a trip to get a filling.
Let me add to that. If you suck a lot of candies, you know, can cause root cavities, which is not on the surface of the tooth, it's on the root surface. And those are really a kind of challenging to fill, but make sure you stop that so that you don't have that many root cavities as well. And if you have dry mouth and you feel that you have to suck on something, ask your dentist about the sugar-free or the candies that are really good for your teeth, that can't harm it. The number one, which we mentioned in our early segment about xylitol. Xylitol is one of those sugars that are good for you. They don't cause any cavities. So there's xylitol candies, there's xylitol melts, there's xylitol chewing gum, or anything with xylitol, it can help you with dry mouth.
So let's recap the 6 bad habits that you should avoid to protect your teeth.
Number 1, nail biting.
Number 2, frequent snacking and sipping.
Number 3, brushing really, really hard.
Number 4, using your teeth to open packages or chewing ice.
Number 5, bedtime bottles for infants.
And number 6, sucking on candies.
If you find yourself or anybody doing any of these things that's on the list, you need to try and break this habit.
Yes, you may save yourself or them from a trip for a crown or a filling.
Well, thank you.